Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton, and this week we're going to talk about autism. And honestly, I'm a little surprised that it's taken us this long to get to this topic.
Yeah, autism is a lot about how we relate to the world, or how people with autism on the spectrum relate to the world, how they communicate, how they interact with others. And so it is, I don't know why it took us so long to figure out this might be an interesting topic to talk about.
Yes. So we're going to start with talking about what autism actually is, because I feel like autism is thrown out in what you like to call pop psychology, right?
Yeah.
It's kind of like, I feel like it could be similar to addiction. People say, oh, he's addicted to this, when really it's problematic behavior and it may be compulsive, but it's not actually, doesn't fall into that category of addiction. So I want to start by talking about what autism is and what it isn't.
Okay. So let me do an explanation, kind of an historical explanation of how the terms have changed. So back in 2013, I think, is when the DSM, which is the Diagnostic and Statistical Manual, it's the thing that psychiatrists are the ones who typically put that out, but psychologists use it as well, mainly for insurance purposes. But it is the manual that describes, different mental disorders, and it's what we use to do the diagnoses. So back in 2013, that changed. It went from DSM-4 to DSM-5. And so before that, a lot of people may be familiar with the term Asperger's syndrome.
Yes.
So back then, there existed these three levels of what we might call autism spectrum disorder. One was just autistic disorder, and so that would be more severe cases of autism. There would then be Asperger's syndrome, which would then be on the other end of the spectrum, which would be those cases that were pretty mild and, pretty high functioning as well. And then the third one is what was called pervasive development disorder.
Okay.
And that was for generally children who fell in between. They weren't autistic and they weren't high functioning like Asperger's. And so they were somewhere in the middle. And so back in 2013, the DSM came out with version 5, and it changed that completely. And so Asperger's syndrome as a diagnosis doesn't exist anymore, and hasn't for quite a few years. And they just went to what is called autism spectrum disorder.
Okay.
And then with 3 levels. So essentially, it feels the same to me, just using different words, which often happens with the DSM. So autism spectrum disorder, and now they abbreviate that often ASD, ASD level 1, ASD level 2, and ASD level 3. And they really correspond to ASD level 1 would be what used to be called Asperger's, ASD level 2 would be what used to be called pervasive development disorder, and then ASD level 3 would be what we just called autism. But honestly, I don't know the reason that they made the change. I think often those changes are made for simplification to make it easier to diagnose, and maybe that was what it was. But I just wanted to let people know that Asperger's does not exist as a diagnosis anymore, because that's one of the, it used to be, well, you're autistic or you have Asperger's. So does that make any sense to you?
Yes, it does. And that's actually very clarifying, because I didn't know all this about the change. I mean, I knew that there was a change, but I didn't know the specifics. But I do know that there are still people who consider themselves to have Asperger's. In fact, I met someone who is in his mid-20s, and he said, yes, I have Asperger's.
And so, he was probably diagnosed with that. And he, it really, in my mind, it doesn't matter what
I know.
He would just be autism spectrum disorder level 1 now. And to me, it's exactly the same thing. So let's talk about what is autism. It's a neurological and a developmental disorder that affects how people interact with others, how they communicate, learn, and behave. And so it can be diagnosed at any age. but typically the symptoms generally appear in the first 2 years of life.
Okay.
And
Yep.
so it's something that certainly is typically there from the beginning. It's not something that develops over time. And, as far as the cause, honestly, for a lot of these things, people don't really know what it is. All we can say really is that it's a combination of genetics and then the environment. But, more than that, I don't know that anybody knows really what's going on as far as how much genetic, how much environment. But,
Yeah.
we talked about this before, that a lot of mental health issues are that there's almost always a genetic component to it.
Hmm.
It's really hard to tease out. And then there's almost always an environmental or a social aspect to it as well. And that's the same with autism, ASD. I'm going to call it ASD just for simplification, if that's okay.
Yes. Yeah. Yeah. So really quick, when you say environmental, I want to talk about that because I don't want parents to walk away thinking my kid has autism. What did I do wrong in their environment?
So I think that when they talk about environmental, I think they're talking about toxins or substances that you might ingest or be exposed to when the baby's in utero.
Okay.
That's mostly what I think. I don't think when people talk about the environmental influence on autism, I don't think it's about parental influence.
Okay. So this also leads us into this whole debacle of vaccines causing autism. That's worth
Right.
talking
So
about.
right. And personally, I don't believe that's true. I think there's absolutely no evidence for that.
Hmm.
But you may feel differently about that. And there's certainly many people out there who do. But in the medical community, it's nothing's unanimous ever. But if you were to talk to any physician, they would say that's absolutely not true. And there's
Yes.
no evidence for it. But
Yeah.
I think that what we don't understand is there are all sorts of things that are in the air we breathe, the chemicals, the things we use. And I think that's what they're talking about as far as environmental aspects, because we know that those types of substances do affect us in some way, but we just don't know what it is.
Hmm.
Very hard to tease out.
We definitely can't point to it and say, yes, this is what specifically causes it, because we have seen kids from all different backgrounds, all different demographics. So I am thinking of Laura Cleary. So she's an YouTube slash Facebook personality. Like she's very, very well known. She's got millions of followers. And I
Hmm.
know for a fact that she is vegan. And so
Uh-huh.
she eats very, very clean. And her son was diagnosed with either level 2 or level 3 autism.
Hmm.
And so, I guess what I'm trying to get at is I don't want parents walking away thinking I need to not let my kids eat any preservatives because it's going to help prevent autism, because that's not the way it works and that's not what
No.
we're talking about.
No, no, I don't. That's absolutely right. Is that it's unknown.
Yeah.
We just don't know. And the way I understand it, it's the things that we encounter throughout life that we don't know that we encounter these things.
Yeah.
So I don't think it's about restricting diet in any way. Plus, my thought is this happens in utero. It's not something that happens after they're born.
Okay.
And so the genetic influence is there, and you're exposed to something in utero is probably
Right.
what it is. But so I think the child is born. I don't know that the parent has any influence. In fact, I'll go out on a limb here. I don't think the parent has any influence as far as their behavior that would cause or not cause autism.
Yeah. I think that makes a lot of sense. I think it's one of those things where it's kind of like cancer. It's going to happen to some people, it's going to happen, and it's not going to happen to others. There's nothing you can do to control it. You can
Right.
only confront it and deal with it when it happens. So I guess the takeaway from what we're trying to get at is don't try to prevent it, don't try to understand it, just learn to deal with it because it's reality. It is what it is. This is life. Like this is your lot in life now. And find a way to cope with it because it doesn't have to be a bad thing. Now, it can pose difficulties. So, people who have level 3 autism, that's a lifelong challenge. I
Right.
want to acknowledge that. And I want to acknowledge that parents who are dealing with that, they are struggling and they have very real struggles. But what I'm saying is don't put that guilt on yourself because it was not your fault and there's nothing you could have done to prevent it.
Right. I agree with that. So let me just point out the difference between a disorder and a disease, because you mentioned cancer, and they're very different. So a disease is something that typically progresses. So
Okay.
cancer is a disease, and then over the lifespan or over a period of time, it will likely get worse. And even if you treat it, it progresses. Whereas a disorder it just is. It doesn't change throughout the lifespan. And so
Okay.
it's not like it's going to get worse. It's not going to get better. What you can do is you can learn skills. And so you can learn to live with it. That's what the difference is. I think we can talk a little bit later about the medication, sometimes medication issues, but that's only to treat things like hyperactivity. And so you might give a stimulant the same way you would give someone who has ADHD.
Okay.
And so it's not that you're actually saying, okay, this is going to help the autism. It's just, some of the symptoms, some of those medications like an antidepressant or a stimulant might help some of those symptoms that exist.
Okay. Yeah. Which I mean, again, is good information. And I like that you made that differentiation of the difference between a disease and a disorder, because I mean, autism is not necessarily going to, it's not going to change, right?
It typically isn't going to change. The person's ability to live with it might change and
Mm-hmm.
with it. But that's going to be through treatment, which is typically behavioral.
Okay. So I would like to share an experience I had with an autistic kid I was probably about 14 or 15
Mhm.
at the time. And it was a little bit alarming. Mainly my dad was the one who kind of freaked me out. So this was at a church dance. And so for context, I'm the only girl, and my dad was terrified of me dating and terrified of me interacting with boys. He very much had that, like the father holding the shotgun while his daughter's in the prom dress.
That was your
That's,
dad.
oh yeah. Oh yeah. And so my dad comes to me and he's like, you should ask this boy to dance. And I'm like, wait, what? My dad is encouraging me to interact with the boy? Like, what is this? Like, what is going on? And so I do. And so we're dancing, and he has like these really odd ideas. Like, I think he talked about, and it was religious things, but he was talking about the things that kind of made me go, okay, right. And really, he was just different, and I didn't understand. So at the end of this dance, he takes my hand and he walks me over to meet his parents. And I'm like freaking out. I'm like, what is going on? What is this kid doing? And my dad's right there, and I'm expecting him to be like, what is this boy doing touching my daughter? Because that's how he's been my entire life. Like, what are you doing with that boy? But no, my dad is just smiling and he's just encouraging. And I'm like, Dad, what are you doing? Like, save me. And so he introduces me to his parents, who are just beaming and are so excited. And I kept my reactions internal. And in hindsight, I'm really, really glad I did, because even though internally I was uncomfortable, that was a really big deal for that kid, who I later learned was autistic. And I
Mhm.
didn't know, I'd never been exposed to it. But, his parents were just so pleased at this. And someone later said, like, no, that's a really big deal. And that's great that he did that. And my dad knew that. And so that's why he was like, oh, okay, yeah, good for you. Or I'm glad that he's doing this. But I'm sitting here wondering, Dad, what are you doing? Right?
It would have been helpful if your father had been more open with you.
Exactly.
I had actually a great experience back when I was doing my education. As part of my education, I ended up, I think, working 6 months in I can't even remember what it was called now. It's different. I think it was called the Pingree School for Autism. And I worked in a classroom. I think if I remember right, the kids were probably around 6, 7, or 8. And so it was an educational setting, but also a behavioral setting. And it was a great experience
Yeah.
to do that. And so I was just there more as an aid than anything, being exposed to it. And I would certainly help out, but, helping the kids get to lunch and things like that, and doing their physical activities. I had that early exposure to children with autism. And I think this goes back to, a couple of episodes ago when we were talking about how do you interact with people who are different. And I think that a lot of it is just, it's about exposure.
Mm-hmm.
The more you're exposed to people who are different than you are, then the easier it is to feel comfortable around them.
Yeah, which is a big part of what we're doing in this podcast, is trying to help people understand. So let's talk about what it looks like having level 1 autism versus having level 3.
So we'll go over some of the signs and symptoms of ASD. And so the spectrum, the idea of what is a spectrum, what does that mean? And I often think of it in terms of a continuum.
Okay.
Which a lot of mental health disorders do fall on a continuum, meaning you can have it very mildly or have it more severely. And often what that means is just the symptoms are either mild or the behaviors are mild or they're more serious. So several years ago, quite a few years ago, I was treating a couple. And the woman kept asking, she said, "Do you think my husband's autistic?" And she may have used Asperger's because it was back before 2013. And so she gave me this book, and I can't remember the name of the book, but I always think of it in terms of it was the big book of everything you wanted to know about autism.
Okay.
And so I read this book, and I started looking in the very first chapter. The author, who was male, was talking about men who, I think it was specifically men who have autism, and how they are in relationships.
Okay.
And when I got done with the first chapter, I commented to him, I said, "This chapter describes every man I've ever treated." And I know that all the men I've ever treated are not autistic or have Asperger's. And so I think that these symptoms that I'm going to talk about.
Okay.
So if we divide them up, the first area would be social or communication or interaction with others. So making little or inconsistent eye contact. Now that happens with me in the office all the time, but I know these men are not autistic.
Yeah.
That they have, and I think often that's the way they grow up.
Mm-hmm.
Or maybe they have low self-esteem or low self-confidence. And so
yeah. So let's give a caveat that we often like to give when we're talking about a list of symptoms.
Yes. Go ahead.
Just because somebody has one of these does not mean they fit this. It's all of them together. So that's a big caveat that we often give. And it's important here because, I mean, not making eye contact, there can be a myriad of different reasons of why you're uncomfortable making eye contact with people. It doesn't mean you have autism.
Right. And so for our female listeners out there, if they're in a relationship with a male, some of these may make sense to them, but that doesn't mean that the person you're with is autistic. Thank you for bringing that up.
Yes.
So little or inconsistent eye contact. This feels similar, but appearing not to look or listen to people who are talking.
Okay.
You know how often I hear that? My husband does not pay attention to me.
That sounds more like human beings than anything. Right.
That's what I said to this woman. I said, this just sounds like all of us.
Yeah.
Infrequently sharing interest, emotion, or enjoyment of objects or activities, not responding or being slow to respond to one's name or other verbal bids for attention, having difficulties with the back and forth of conversation. See, now these start to make more sense to me.
Mm-hmm.
Like if you're autistic, you're going to have trouble that back and forth with conversation. And you, as the person who might be interacting with someone who's autistic, you will notice that. It will be pretty evident because you'll start to wonder, okay, what's going on? There's something that's not quite right here.
Yeah.
Often talking at length about a favorite subject. So they tend to really focus on a subject. Like I think the movie Rain Man. Maybe you haven't seen that. It's an old Dustin Hoffman, Tom Cruise movie. And so Dustin Hoffman plays an autistic guy a savant who had a mathematical ability, but he focused on, I can't remember what he focused on.
Yeah.
But, you go on and on about this favorite subject without noticing that others are not interested. When I was doing some research before getting into graduate school, I was working in a lab where they were working with people who had Tourette syndrome. Mm-hmm. And then I think they were also looking at autistic kids. And some kid came into the lab and he was probably 10 years old. And he could tell you all these different models of vacuums. So his interest was different vacuum cleaners
Mm-hmm.
and what they did, and I think he had how much they cost, things like that. But when you asked him how would you use this, he had absolutely no idea. His interest only focused on the details of
Mm-hmm.
what the vacuum looked like and what it did, and or like the characteristics of it, not exactly how you would use a vacuum. And that's pretty typical, I think, to
Okay.
have a very narrow focus interest. Displaying facial expressions or movements or gestures that don't make sense given the current context of what's going on. Some of them have an unusual tone of voice, maybe flat, robot like. It could be also sing songy. Having trouble understanding another person's point of view, or being unable to predict or understand people's actions, difficulties adjusting behaviors to social situations. And kids who are autistic on the spectrum often have difficulty sharing in imaginative play and making friends. So that's the social aspect. Restrictive or repetitive behaviors can include repeating certain behaviors or having unusual behaviors such as words. And maybe this is where we got into it with Tourette's, they repeat words or phrases. Having a lasting, intense interest in very specific topics like numbers, details, or facts. That's the thing about the vacuum cleaners.
Mm-hmm.
Showing overly focused interest, such as with moving objects or parts of objects. Becoming upset by slight changes in routine.
Okay.
So having difficulty with transitions,
Mm-hmm.
moving from one place to another. And that's one of the things that really stood out to me in my experience, back when I was doing my training. Being more sensitive or even less sensitive to sensory input, such as light, sound, and clothing, or temperature, like loud noises are often
Mm-hmm.
really hard for them to take. Whereas, kids who are not on the spectrum might be uncomfortable with a really loud noise or not like it. But the person who's on the spectrum, they experience loud noise and they might cover their ears and run from the room. And
Mm-hmm.
it might be a really big reaction. So those are some of the restrictive and repetitive behaviors. So I think if you're looking at the difference between level 1 and level 1, I think you can really get along in life pretty well.
Yeah.
You don't need necessarily a lot of help. But I
Mm-hmm.
think level 3, let me just give you what the DSM says about it. The most severe end of the spectrum is level 3, which requires substantial support.
Mm-hmm.
Those signs associated with both level 1 and 2 are still present, but are far more severe and accompanied by other complications as well. So their ability to communicate and to interact socially with others is severely limited. I mean, that's one of the things that really sets apart a level 1 from a level 3.
And I met someone who was level 3 autistic, or rather I knew someone, and it was a huge struggle for him and his mom, and they came to church with us, and they required a lot of support, and they required a lot of community support. A lot of it had to do with the fact that he was nonverbal,
Mm-hmm.
and he was also larger than his mom. He was just a big kid. And so she would oftentimes lose, like physically, he would lose control and he would get violent and, like pull her hair or start hitting her,
Yeah.
which is very hard to deal with and also very hard to understand. And so thankfully, we lived in a really good community and they were willing to work with both of them. But law enforcement and EMTs and local fire departments were familiar with him and knew his situation. And so obviously, this is a level 3, probably it's one of the more severe cases out there, but
Mm-hmm.
that's the reality for some people with
Yeah.
autism.
Right. And so, again, that's why it's called a spectrum, because you could be
Yeah.
on either end of that spectrum. I mentioned medication, and that might be a case where medication would be helpful to change some of or dampen some of those really troublesome behaviors like the
Hmm.
physical aggression.
Yeah.
But typically, the treatment, especially say for level 1 and level 2, is really behavioral. Now, it's important to understand let's say you've been diagnosed as being on the spectrum, ASD. If you find that it doesn't cause any disruption in your life or problems, then there's absolutely no reason to get into any type of treatment. So,
Yeah.
with any disorder, it's really any disorder that exists on the spectrum, it's really about how seriously does it affect your life?
Mm-hmm.
And so for some people on the spectrum, it's not going to affect their life in a very big way. Like there are many, many people out there who were previously diagnosed with Asperger's or level 1 ASD who get along in life just fine, and they have
Mm-hmm.
meaningful relationships. And, their partners just need to understand what the constraints are in the relationship or what to expect. So I don't want listeners to think that anyone with ASD should have some sort of treatment. That's just not the case.
Yeah. And I also want to bring up, so as you were reading that list, I'm thinking these sounds like symptoms that at some point most human beings will experience in one way or another. So, but obviously we're not all autistic. And it's kind of like a lot like depression. When it becomes a problem is when it affects your life, your quality of life. That's when it's a problem.
Right. And that's something that you reminded me of something I really wanted to bring up. So typically, the first people who are going to notice it will be teachers and
Okay.
notice that behavior, and they might suggest some sort of assessment. Although, whatever the National Pediatric Association, I think it's the APA, American Pediatric Association, recommends that there is a evaluation for autism for kids at a very young age, that it
Mm-hmm.
becomes a standard part. I don't know if that's actually done or not, but that's the recommendation. But here's the thing I was thinking about, that children who experience trauma, and at a young age, trauma in the home, are going to exhibit some of these same behaviors.
Yeah.
And so I think that when the assessment is being done or when you're thinking about it, you really have to think about what is the context of what's going on in the home at that time. Because any type of, scary behavior that might be going in the home may cause a child to react that way, to pull in, to not look at others, to not communicate, to, be really quiet. And so I think we have to be careful that we don't disregard whatever else is going on in that child's life. And I think that's true even for older kids as you're if you're diagnosed when you're older. I would be very careful to understand what's the context of this kid's life.
Right. I agree with that. And I'm really glad you brought that up. That sounds a lot also like ADHD in children. I mean, I think
Yeah.
children are very often overdiagnosed with ADHD, and really it's because there's something else going on in their life.
Mhm.
And so one of the things that I did want to talk about is because oftentimes, or I hear a lot about kids who are diagnosed like at the age of 2, and I've heard it described as a sudden change came over their child. Like all of a sudden they were developing normally and then they kind of just stopped talking and they stopped making eye contact.
Mhm.
So let's talk about that. And I mean, that sounds more environmental, right? Like what we talked about. But again, it's happened so many times and there's no one's been able to define why it happens. It kind of seems to be this gradual, my 2-year-old kind of stops talking or he just starts acting different.
Right. And I think that's one of the reasons that whole vaccine causes autism thing
Yeah.
gets started, is because situations like that happen. I should have talked to my daughter Sierra about this because she has a lot more expertise, I'm sure, on that. And she probably even does the, evaluation, the autism evaluation with the children. I think that I have never heard any explanation as to why that happens. But
Yeah.
one can imagine that genetics, even over time, it changes. Like, I mean, as the child develops. So that's why it's called a developmental disorder as well,
Mm-hmm.
is that over time it's going to develop. Now, it's most often seen in children by the age of 2. That doesn't mean it's always going to be seen in children by the age of 2. And
Okay.
so I think that the expression of it, probably can happen anywhere in childhood. But as far as why, I wish I had an answer. I'm sure a lot of people wish they
Yeah.
had answers as to what's going on, but we don't know what's going on.
Yeah. The only thing that we can do is just confront it and find a way to cope. So,
Right. And I mean, as you said at the beginning of the episode, it's about acceptance and then getting, if treatment is appropriate, sometimes it
mhm,
is, sometimes it's not. But there are a lot of resources out there. And again, I'm only familiar with Salt Lake City, but Valley Mental Health, they're the community mental health system in the Valley. And they were the ones who, gosh, I don't know, 25, 30 years ago, were running this autism center that I worked in, and they're also the one. They have this really great facility by the University of Utah. It's fairly new, and I still think it's called the Pingree Center for Autistic Learning. So I wish I knew what the exact name was, but I understand it's a really great facility. And so nowadays, I think there are a lot of options
mhm.
for children who are on the spectrum, either for their educational work or even behavioral. And so there's help out there. If you think that your child might be on the spectrum, then it's good to have an evaluation just so that you then get hooked up into the community, because there's a very active community out there of parents and caregivers who are concerned about children with autism. And so there are a lot of resources. You shouldn't try and do this alone. At least
Uh,
I wouldn't. I
oh,
wouldn't. I just think there are way too many people out there who know a lot more than you or I know about this, and who have a lot of experience in helping children with who are on the spectrum, and then helping their parents as well and learning how to cope with it. So I think that's one of the big takeaway messages I hope that people get, is that I would guess it's mostly a genetic issue.
mhm.
It happens sadly, and get the evaluation, and then also hook into the community that's out there to see
Yep.
what's available.
Yeah, absolutely. And it needs to be a family thing,
Mhm.
right? So if you have a child who, and rather it's your first or your last child, no matter what, your whole family needs to be involved in the treatment plan and involved in this community and involved in these resources, because, it's going to be a team effort, and this person is still going to want to be loved. They may display it differently, but they still want and need love and affection, and they're going to need that human interaction and that physical interaction. And so as a family unit, you need to know how to help meet those needs. And so siblings can be involved with treatment and with coping skills. So find someone who's an expert. And because like every person is different, every disorder is going to manifest differently in different people. I would imagine no two autistic people manifested the exact same way. Those are all things to keep in mind.
But honestly, as an adult, if you're, let's say you were a level 1 ASD
Hmm.
and you didn't have that diagnosis and you're getting along in life just fine, I don't really get what a diagnosis is going to give you.
Yep. Yeah.
You aren't going to get treatment. You don't need treatment. You get along in life fine. You may have some difficulty in the relationship, but again, I think on a level 1, I think you can learn how to kind of change or mitigate that behavior. But often when I see couples, people want to put a label on things.
Yeah.
And I don't know what, I guess it gives them a sense of control,
Hmm.
perhaps, that they understand it. And maybe it's also a way that they then don't take the behavior so personally.
And that I can see being helpful. And I think knowledge is power. And I think sometimes, I think it's a lot like why we label kids' emotions is because it helps them to better identify and to better cope. So I can see it making it easier to cope with someone if you can say, okay, now I understand why they exhibit this behavior. I can better understand it. And now I can learn to cope with it.
Yeah. So the treatment of children, typically who, might be level 1, level 2, or even level 3, is to learn social communication, language skills, reduce some of those behaviors that interfere with daily functioning, increase or build on strengths, and then learn some life skills that are necessary for living independently. And some of these people will not be able to live independently, but I think a lot of them can.
Hmm. Yep, absolutely. All right. So next week, we're going to switch gears again, as we tend to do on this podcast, and we're going to get into eating disorders. And so we'll kind of hit the classics of like, anorexia and bulimia. But we're also going to talk about kind of compulsive eating and overeating and the psychology behind that and why that happens, which is perfect going into the holidays, the season of excess.
Right. That will be a good topic.
Yep. We will see you all next week.
Goodbye, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.